Well, our next guest is a breast cancer survivor who is feeling good from the inside out these days. And America's favorite dermatologist, Dr. Tess Mauricio, partly responsible for putting that smile on her face. Dr. Tess is here along with the beautiful Barb Whitesize. Looking good, lady.
Well, thank you. I'm feeling good.
It's wonderful to have you here. Dr. Tess, we're going to talk all about this very new cutting-edge procedure that you were able to do with Barb, which really has changed your perspective. But let's first talk about your journey. 6 years ago, you found out you had breast cancer.
Right. It was just about 6 years ago now, and it was an interesting situation because I had had a mammogram 4 months before, and it was clear. And then I was able to find the lump. So it was really a very difficult time for me, a transition that I just had a rough time going through and feeling as though I could really deal with this at all. So I was very, very happy when I had a lumpectomy. And I've had my 5 years, that requisite 5 years where you feel like, okay, I'm going to be able to go on. I know, but you still, because you've had a lumpectomy, it's a weird thing with women because you are so grateful, as you should be, that you've been able to survive this, that you don't really notice the other scars that continue. And it was an interesting thing because my husband discovered it before I did. What he discovered was that it had taken a toll on me, that it would really have taken a hit on my self-esteem. As I said, I was just so grateful to have survived that I was not aware of it. And it's touchy between couples because your husband doesn't want to make you feel in any way that he finds you less attractive, but he could see it, and he suggested that I go and talk to a plastic surgeon, and I did, and the plastic surgeon said, because I had one breast was larger than the other, was what was going on. And the plastic surgeon said, well, we would have to cut into healthy breast tissue in order to create symmetry here. And we really are uncomfortable with doing that. So I was getting used to the fact that I was going to have to live with myself that way.
But fortunately, you had worked with Dr. Tess before, doing some laser work and other treatments, so you reconnected with her and found out about this amazing new cutting-edge procedure that she was able to do. So Dr. Tess, what is this?
Well, you know, now it's we're really cutting edge as far as recycling. Basically, we're removing fat from areas that patients don't like, and for Barb, she's like, oh yeah, you know, I have some around my waist and around my abdomen, and then we're harvesting it in such an amazing way. It's a technology called Body Jet and Harvest Jet, and it's basically like spritzes of water and putting fat into solution, harvesting it, and then at the same time, we're able to transfer it and revolumize areas that are, you know, whether it's from aging or for Barb, obviously, we're trying to create symmetry. I was able to re-inject her own fat in that breast where she had the lumpectomy. And we were like so amazed. She was actually awake during the whole procedure.
I was watching.
You were watching the procedure. That must have been an out-of-body experience.
It really kind of was, but it was amazing to watch, and it was so gentle. And working with Dr. Tess just makes me feel better anyway, because I had complete trust in her.
She's a gentle spirit. She's got a lot of compassion, that lady.
Yeah, and so the other thing is obviously the lumpectomy, we fixed it. And then the other thing that happens as we all age as women is that the normal breast was also a little, you know, saggy. So we're like, hey Barb,
that darn gravity thing. I mean, come on.
Like, hey Barb, let's just go ahead and like make that other one, you know, perkier. And so that's what we did, and we're like, oh my God, Barb and I were almost in tears immediately after, because you could really feel, and I know that, I mean, today I'm not bringing any before and afters, and Barb, I mean.
Yeah, well, the befores were on my heart, and I didn't even know it, because I was so good at camouflaging what the issue was. Anything that you saw, you wouldn't necessarily see the difference, but I saw it every time I looked in the mirror.
So your husband brought this to your attention in a very gentle and loving way, and then you went and sought some help and some treatment. How are you feeling about yourself from the inside out now?
Unbelievable. I could not believe what a difference it made for me. Again, I think women feel very grateful to have survived, but they don't realize that they can also get a tremendous amount of self-esteem back by addressing the other kind of scars that they have.
Right, and it's really beyond, that's why it's really more than skin deep. And I see it a lot, you know, in my clinic, and I'm just so grateful that Barb is willing to share this story, because we do have a lot of patients who come in, and I do see that internal, almost spiritual transformation from all these things that we get to do, and all the new technology, sculpting the body, restoring restoring Barb to where she was prior to this kind of horrendous, you know, experience of having had breast cancer, and then really giving her life, you know, the way and that she wants to live the rest of her life, you know, basically.
And Dr. Tess, you want to be able to do this for other patients as well in a way that's affordable, that will help their family be able to do this. So you have a special today. Right.
Well, it's buy one area of Lipo and get the second area free. And so if at the same time anyone is thinking, well, I'd like to revolumize my breast, my face, my hands, any of those areas at the same time that I'm sculpting areas that are problematic, and usually for women that's, you know, the midsection, the thighs, the arms, come on in, and this is an amazing special, and it's a very, very popular special. And they don't have to have their procedure done by the end of May. They just have to kind of come in and purchase it, and then we can schedule that. And it's, like I said, it's so amazing as a surgeon and as a woman. I mean, I can't even explain, and I get so emotional about it. My patients and I kind of have this amazing bond, and I'm just...
That's so true. And, you know, I'm still very grateful to be in the position that I'm in, but I'm also really grateful for Dr. Tess.
Thank you so much, Barb, for coming on, having the courage to tell your story, and just really sharing for other women or men who are looking for this in different areas of their life or body, that it's great to be grateful, but it's okay to want to do something beyond that to feel good from the inside
Absolutely.
out. Great to have you both on today, and continued good health to you.
Thank you.
Looking good. Hot stuff. More information, just go to our website, san diego6.com, and click on San Diego Living.